Hello, my name is Liz and I'm your friendly neighbourhood breast surgeon. My claim to fame is that many years ago when I was a trainee, I set up the mammary fold with my friend Steve Thrush, who's now a breast surgeon in Hereford. And I actually named it as a joke, the mammary fold, but the name stuck. And 2 decades on, it's going from strength to strength. And I would encourage all of you to join the Mammary Fold if you're considering a career in breast surgery, because a membership is free of charge for foundation trainees and core trainees. So my real job is as an oncoplastic breast surgeon, and I've worked at East Sussex Trust now for about 2 decades. So what's an oncoplastic breast surgeon when it's at home? Well, I'm a cancer surgeon and I'm also a reconstructive surgeon. Oncoplastics was a term that was first introduced by a professor of plastic surgery called Werner Outresch in Düsseldorf. And in 2002, the Department of Health in the United Kingdom decided to create this new subspecialty of oncoplastics because at the time, patients were not getting access to breast reconstruction. In fact, I have another claim to fame because I am one of the first oncoplastic trainees in the country. Now, how do you get into breast oncoplastic training, therefore? Currently, this is still under the umbrella of general surgery. However, there are changes afoot, and it is feasible that in the next few years, we might see breast surgery amalgamated with plastic surgery and become a standalone specialty away from general surgery. However, at the moment, breast surgery is very much under the umbrella of general surgery. So for those of you who are foundation trainees, if you decide on a career in surgery, there are 2 pathways you can follow. Either you enter through run-through training, which is ST1, ST2, and then get into higher surgical training, or core surgical training. Now, run-through training is only available for general surgery, but core training is available for all the specialties, so orthopedics, general surgery, plastic surgery, ENT, and so on. During that time, you have to pass your MRCS examination. In my day, when I was an SHO, it was the FRCS, but nowadays it's been dumbed down, in my opinion, to MRCS. If you don't pass the MRCS, you can't get onto higher surgical training. Higher surgical training is ST3 to ST8. Now, during those 6 years, a breast trainee has got to do 3 years of general surgery and 3 years of breast surgery. During the 6 years, they have to do the general surgery on call as well. That might change in the future. There is some discussion going on about whether the breast surgery curriculum should incorporate at the ST7 and ST8 level more oncoplastics and less on call. But as it stands at the moment, 3 years of general surgery, 3 years of breast surgery, and 6 years of general surgery on call. Most trainees, after completing their CCT, which is the Certificate of Completion of Training, will then also do 1 year of an oncoplastic fellowship before they become a surgeon, a consultant with independent practice. Currently in the UK, there are 14 oncoplastic fellowships. In England, there were only 9 in 2002. There are 14 which are overseen by BACPRESS, which is the plastic surgery group, and ABS, the breast surgery group. But there are also many very good local breast fellowships, such as in Guildford. There's a very good breast fellowship there run by Tracy Irvine, who's a previous trainee of mine, is now a breast surgeon in Guildford. And if you can't get a fellowship in this country, you can go abroad, but it is really valued that all breast trainees should do a fellowship in oncoplastics. These posts are very competitive because both plastic and general surgery trainees compete for these 14 posts, and most of them start in July every year. So that's about how to get into breast surgery. Now, what are the qualities that I think are necessary to make a good breast surgeon? I think you have to be passionate about what you do, and you've got to be a people person. The breast surgeon and breast patient rapport is quite a close one because breast patients do take a lot of personal interest in their own care, and Our approach is also very MDT centered, so you do have to be a really good team player, I think, to do breast surgery. Ideally, you should also have an interest in research because there are a lot of cancer clinical trials, and so research and innovation is also very much a part of breast surgery. It's a wonderful specialty. There's a lot of innovation. Oncoplastics has changed so much even from when I did my fellowship. It is a very rewarding specialty to enter into. There were two people who shaped my career and made me settle on a career in breast surgery, because initially, for my first 2 years, I was thinking of colorectal surgery. But I went to see someone called Dick Rainsbury, who was the college breast tutor in 1997. And he knew that I'd previously had an interest in plastic surgery, but then had entered general surgery. And I went to him for advice, and he mentioned to me at that time that there was going to be this new specialty called oncoplastics, which was going to marry together general and breast surgery and plastic surgery. And he was instrumental in a way shaping my career. After that conversation with him, I went on to do 2 years of breast research with Professor Baum, who was a very eminent breast professor, internationally renowned. And then when I came out of that, I then went to work for Andy Belzum, who was a friend of Dick Rainsbury's, who was running one of the first oncoplastic fellowships in Manchester. So along the way, you will meet these people important people who shape your career choices and who inspire you. And my inspirations were definitely Dick Rainsbury, the surgeon from Winchester, and Andy Belzum, the professor in Manchester. There are downsides, I suppose, to breast surgery like any other profession. Not many. I think there are possibly two main downsides of breast surgery. And one is the volume of outpatient work. We have very high volume of targets and outpatient work. And the second thing, I think, is that in spite of all the advances in oncoplastics and all the changes that has happened in the last 2 decades, there is that slight stigma still attached to breast surgery, where general surgery trainees might feel that the breast surgery trainees have a cushier life, and because they're not, when they get appointed as consultants, they don't have to do the on-call and so on. But that really is a myth. If you want an easy life, then breast surgery is not really the correct career choice, because it is as busy as general surgery, but in a different way. However, all surgery is great. I recommend surgery to you as a career. It's a wonderful career to enter into. I decided I wanted to do surgery very early on as a medical student, within the first month actually of joining med school. So I recommend it to you, and good luck to all of you.